Welcome, and thank you for joining us. It's great to see such a large group participating in today's meeting. Hi, I'm Rita Graff, the Chief Administrator for the Southwest Ohio Tech Prep. I'm excited to be here today, along with our Southwest Ohio team, which includes Cincinnati State Technical and Community College, Great Oaks Career Campuses, Butler Tech, Warren County Career Center, the Health Collaborative, and the Healthcare Management Group, a long-term care employer with multiple locations within our Southwest region. As you can see, our Southwest team is small in numbers, but I assure you, we all stand strong in our commitment to this work. We're here today to share with you some positive information that has already taken place in regards to some of the administrative rules that our region identified as obstacles that limited our region's ability to create a more robust nursing talent pipeline, and how through partnership and advocacy, we were able to achieve change. We will also share the great opportunities we see in participating with you to expand our thinking, build consensus on ways that we can move forward, continue to advocate where it is appropriate, and create a greater statewide impact on this vital healthcare pipeline. Before we get started, I'd like to ask you to please take a moment to enter your name, organization, and email into the chat so we can follow up with you. We can follow up with you on your interests in continuing to work with us. Also, I want to invite you to use the chat. Make sure you put your information in our chat. So the second half of our meeting today is actually set aside for your input for question Q&A. And hang on just a second. So now let me turn you over to Steve Boymel, President of the Healthcare Management Group, to hear an employer's thoughts on why this work is so imperative. Steve?
Thanks, Rita. Good morning, all. I've been keenly aware of the nursing shortage for over 3 decades and have submitted proposals to solve it to the last 5 governors. It's a simple idea: create a high school STNA and LPN program to get more people into the workforce. June 2021, I met with Governor DeWine and again presented my proposal. He liked it and referred me to Harry Snyder, Superintendent of Great Oaks Career Campuses.
I did.
Can somebody mute? Excuse me. Could everybody mute?
No, thank you.
I've been working with Hope Arthur, Executive Director of Workforce Innovation at the Health Collaborative.
It's a credit card. Right?
April
Thank you.
2021 on workforce issues, and had explained my simple idea to her, and she liked it. So I had this great idea and didn't know how to execute it. And as it turned out, it took a village of professionals to identify the problems. Hope and I met with Harry and his team and identified some obstacles that we needed to overcome. Next, we met with Robin Hoops, Cincinnati State's provost, and discussed the pandemic and how it highlighted how bad the workforce challenges were. Currently, I can't stress this enough. Healthcare employers are experiencing workforce shortages in record numbers across all positions and need employees from entry level to RN, and that is great. The RN shortage is at the highest levels we've ever seen. Hope assembled a team of professionals to identify obstacles to create a high school STNA and LPN program. She brought Denise Rohr, Associate Provost, Cincinnati State, Rita Graff, who you just met, and Marianne Krismer, prior Dean of Health and Public Safety at Cincinnati State, and a current consultant with Tech Prep. And Harry brought Joel King, now Superintendent of Warren County Career Center. This small group of professionals identified several issues. First, we decided we needed an ITAG for LPN. And as members of the state's ITAG committee, Robin worked with Denise. The group also looked at the STNA obstacles and decided everything would work if the Ohio Department of Health would adopt the federal rules that provided more flexibility on how classes could be taught, allowing distance learning, larger class to teacher ratio, and adjusting the pass rate to the federal standard of 70%, which almost all states have adopted. The governor signed an executive order in July adopting the pending rule changes. Hope and Mandy Smith, the Ohio Healthcare Association Regulatory Director, presented our requested change to the LPN instructor requirements to the Ohio Board of Nursing. They were rebuffed. We drafted legislation with state partners implementing the change, and the governor signed the bill into law in June, which becomes effective next week. We also needed a more robust early college pathway for high school students who currently earned their STNA in the first semester of their junior year and then took the LPN program their second semester junior year through their senior year. We wanted to ensure their LPN courses transferred to Cincinnati State so the LPN graduate could transition to RN. Cincinnati State is making that happen. A challenge we see is the current lack of career technical education centers offering secondary practical programs. There are only 5 in the state currently. As we build out this portion of the pipeline, another issue will be the lack of community colleges offering LPN to RN bridge programs, as well as the lack of adult LPN programs for the career technical centers. We are working on creating separate scrub camps for middle and high school students this upcoming summer, and we're working on funding ideas to cover the cost of setting up STNA and LPN labs. As the employer in this group, I ask that you please join us and help this work grow into a statewide initiative. Now, let me turn you over to Joel King, Superintendent of Warren County Career Center, to share some of the specifics as to what we have achieved so far.
Thank you, Steve. Good morning, everyone. I'm happy to be here today to share with you what we've achieved so far and why we believe it matters. When our group came together, we started with looking at the barriers that our different organizations were experiencing, particularly for providing more students with access and success in earning the STNA and LPN credentials. Once we identified the issues, we started to work with the different governing boards for the rule changes that needed to be implemented. So we worked with the Ohio Department of Health and the Ohio Department of or Board of Nursing and the governor's office to advocate for rule changes. So the slide that they just put up, you can see for the LPN programs, this resulted in changes in the law that permitted LPN faculty to include any individual who is scheduled to receive the baccalaureate in nursing within 12 calendar months. Additionally, while ODH, the Ohio Department of Health, is finishing its formal review process, as Steve mentioned, we were able to work with the governor who issued an executive order putting in place their expected rule updates that included 4 items that we think are game changers. Those 4 items, right-sizing the train-the-trainer requirements, which should make finding instructors easier, allowing didactic learning to be delivered virtually, which I think coming out of the pandemic, we realized is something we can be very successful with. Next, allowing programs to request to use simulation for all or part of the clinical requirements. Again, coming out of the pandemic, something we realized that's possible, and still understanding students on the secondary side and the barriers to getting a vaccine or being tested to be able to go to those sites. Last thing, as Steve mentioned, adjusting that passing score to 70% to meet the federal requirement. At this time, I'm going to turn it over to Hope Arthur, the Executive Director of Workforce for Innovation at the Health Collaborative, to share some of our ideas to possible next steps.
Thank you, Joel, and good morning, all. I'm excited to be with you today and to share these ideas that we've identified as ways we could work together going forward. The first is working across the state to increase the number of high school students who are earning their STNA credential. Included in this is increasing student access to earning this in-demand credential prior even to their junior year, and then helping them to connect with employers so that they can work through high school and learn more of the needed workplace, professional and soft skills at the same time. Additionally, we'd like to develop best practices for delivering the program virtually to interested students and to having them then come to the career technical education centers for their skills lab and possibly even the simulated clinicals versus always having to be at the career tech. We've also discussed offering STNA programs in the summer as part of our scrub camps efforts. The second idea is increasing the number of high school students who are earning the LPN credential or license. Currently, Great Oaks is one of only 5 technical education centers in the state offering the secondary practical nursing program. Our vision is to increase this number 5-fold. And we see this as a great way to help more students graduate with early college credit in healthcare and save up to a year of time and tuition towards becoming an RN, if that's their desired pathway. It also would allow the high school students to graduate with an in-demand credential that pays between $22 and $25 an hour, as well as an opportunity to get in with an employer who's willing to support their future post-secondary healthcare education. Several other ideas we believe might also be good next steps include working together to create a statewide LPN curriculum and possibly even include stackable credentials in that, and working together with the Ohio Department of Health to identify best practices for simulated STNA clinicals, as well as working with the community colleges to increase how many are offering LPN and LPN to RN bridge programs. So the students that we're increasing on the career technical side have a place to land. And then working together statewide, hopefully we would, again, with many of you who are here today, on advocacy and on pursuing funding to support building out and implementing the agreed upon go forward plans so that we can truly create a more robust nursing talent pipeline across the state. I'd now like to turn this over to Robin Hoops, Provost and Chief Academic Officer at Cincinnati State, who will facilitate the remainder of today's conversations. Robin?
Thanks, Hope. And hey, everybody. It's a privilege to spend this Friday morning some time with you this morning. So my role here in this presentation is to gather questions, feedback, input that you have for us. So be thinking about those, and you'll be able to type those into the chat. We'll try to respond to them. And also, if you just want to talk to us, you can just talk. I don't think the group is too large just to have that kind of interaction. So as you're thinking about what those questions might be, if you haven't done so already, I think most everybody has, but if you haven't done so already, go ahead and put your name and your email into the chat, because one of the things we're going to do when we're done today is we'll send this information out by email and also be soliciting if anybody wants to be part of sort of a loose sort of coalition across the state, so that if there's things that we can advocate or support each other as a group, if that would be more effective, then we'll be looking to do that. So again, if you haven't already, then go ahead and put your email in. So yeah, so we'll open it up for questions or any kind of input or recommendations that you have for us. As you're thinking about those, one thing I just wanted to share, I mean, you're hearing from us and this group, and we're down here in this corner of the state of Southwest Ohio and doing what we can with the current landscape. And so I know that work is going on everywhere across the state, that in every corner, the career centers and the community colleges, we're working together trying to figure out what we can do. And so typically this isn't something where we would share something out, but it's because in working together and we found these obstacles that were making it hard to deliver LPN and STN programs, and we actually were able to get some changes. We thought it would be really valuable just to get that on everybody's radar, just because I know we're all busy and it might be something that you weren't aware of. But also, we also thought but why wouldn't we want to reach out and see if some of this work is also going on in other parts of the state, so we can maybe work collaboratively together going forward? So that's going to be part of kind of the next step. So if you would like to be involved in something like that, make sure that you give us your contact information. So with that, I will pause right there. Questions, comments, recommendations, concerns, anything, and you can just shout them out if you like, or put them in the chat.
Robin, there is one comment in the chat regarding a concern about students working on their STNA as a junior at age 16, when they must be 18 to gain employment. Is that something you can comment on, or would it be better for Steve as an employer to comment on the age requirements for the workforce?
Yeah, I would say either Joel or Steve. So I think Joel probably has the best lens on that.
Yeah, I can talk about that. I mean, we have students that are working, so I don't know if that's maybe the employer that you're trying to work with has that requirement of being 18, but I know we have lots of facilities in Southwest Ohio that are willing to work with students that are under the age of 18. And kind of a quote from Steve was, if you can get me a student that's got their STNA and they can only work a couple hours, we want them, because he needs to be able to give his people a break, especially with everything they've experienced since the pandemic started. So Steve, I don't know if you want to talk from an employer standpoint.
If I can unmute myself, let's see.
You're good.
You're good.
Hear me? Okay. Yeah, you know, the way I look at it is if they can work on a Saturday or Sunday for a couple of hours, if they can work in the evening and balance their, you know, schoolwork, because that's very important, you know, and we've committed in our company that, you know, if we're lucky enough to get some of these young people, we're going to coddle them along. I mean, we really want them to be successful. We want them to like what they're doing and enjoy it. So, you know, if they work 6 hours, it's a big break on our, you know, our traditional staff.
I'll add, we didn't do a good job necessarily of sharing, but the Health Collaborative is an organization in Greater Cincinnati that our primary members are the 6 major health systems in the region, but certainly we serve the whole of the healthcare talent pipeline here. Where we would hear often from the health systems previously, prior to the pandemic, that they were not willing to hire anybody under 18. That's changed. It's changed in our region. I would bet it's changed in many of the regions across the state. So if you've had challenges with that previously, I would suggest you open those doors again and check in with your employers.
I see there's a couple hands up too. I think Jamie Nash has his hand up.
Jamie, you want to?
Can you hear me okay?
Can you get a little closer to the mic?
Can you hear me okay?
Yes.
This is Jamie Nash of Buckeye Hills Career Center. We serve Gallia, Jackson, and Vinton counties. On the adult world, we serve about eight different counties, 3 in West Virginia. Quick question for you guys, or just got kind of a quick comment. I want to let you guys know we have 3 allied health programs in our secondary division. All 3 of our allied health programs, the students obtain their STNA, and we allow our students their senior year, second semester, we enroll them into our post-secondary adult ed LPN program. And we've been doing that now for a couple years. So our senior students can obtain their LPN for half of the year, and then the other half of the year, once they graduate, they basically they graduate in December, right after they graduate high school. I will tell you also, I'm curious about your guys' input on this. We are in the process of becoming a RN certification training program facility as well. We're working through those processes now. I am curious to see if anybody on this is also working on their RN diploma certificate too, from an adult ed perspective.
So Jamie, let me jump in. This is Robin, who's hopes of Cincinnati State. To go back to the first point about how you use your adult PN program in concert with your high school program for STNA and how that can build in. There, that model is something that Butler Tech is also doing. So I think that's a great model. If if a career center has that PN at the adult side, it certainly shortens the time to credential, I should say. I think it's a great model.
I'll add for the question regarding the RN program on the adult side. Rita, please help me with the name. Is it Collins Career Center that is doing that? You're muted.
Yes, Collins Career Center in Lawrence County. Yes.
Yeah, so if that's of any help, but I would say you've really, Jamie, tapped into the reason why we want to bring people together across the state, because there's amazing solutions that so many people are generating. We know the more minds at the table, the more likely we are to make a greater impact. So I appreciate that. Matt, we also see your hand up. Do you have a question for us? Or comment?
Good morning. Yeah, more of a comment probably. Matt Wells, Department of Education. I am the Education Program Specialist in the Office of Career Tech Education for several industry areas, but health science being one of my main areas. I would say that a couple things. Wonderful work, fantastic work. We're always glad to see collaborations like this that work together to remove barriers for students to be able to achieve certifications, licensure, employment. I will tell you that having conversation with our legislative folks within the last couple of weeks, they have assured us that the governor's office will be moving forward into this next legislative session to examine all areas of the state when it comes to certifications for barriers just like this: age requirements, background checks, high school diplomas, hour requirement. Certainly, we brought up lots of certifications that require 18 years old and a high school diploma. And we have industry credentials that require, that students are trying to get, and they require the student to have those areas fulfilled before they can actually get certified. So it's sort of a chicken and egg situation. They're trying to get the credential to graduate. They got to have the graduation to get the credential. And so we're finding a lot of those types of barriers, and they're certainly going to be evaluating all of our state certification and licensures to try to remove those barriers. Cosmetology being one that's been on the table for a long time. 1,800 hours worth of instruction for students just seemed excessive. I have had conversation with the Board of Nursing in the last 2 weeks. I am slated to speak to the committee. It was actually supposed to be last week, and they had to postpone it to next month. But the community health service worker, dialysis technician, and med aides also have similar type of issues with age requirements and high school diplomas. And so we're going to talk through some provisional situations. They were very, welcoming and really wanted to talk through that process with us. I wanted to speak real quick to the issue of employment. Two things. One is Ohio Job and Family Services definitely have some laws on the books that allow for students that are involved in career tech situations to have some exemptions to some of the labor laws. One, so we're working on a fact sheet that's going to come out of our office here shortly for that. And two is, and certainly there's several folks on the call that can correct me, but I think it's Senate Bill 166 that just came out that gave a sizable tax break to corporations that will actually partner with our career tech students for apprenticeships and employment and those kind of things. So also quite the incentive for employers to work with us. We do seem like we do have to educate a lot of our employers when it comes to that, especially in some of these areas like healthcare, where students are being asked to do sensitive things and invasive type procedures. So we've taken employers out to career tech centers before and said, here's their training, here's what they do. And that seems to help at times. So anything that we can do from the Department of Education to help educate or be part of removing these barriers, that's what we're all about. So just want to say appreciate your work. It's fantastic.
Thank you. Thank you.
Thanks,
And I see a question in the chat too about STNAs needing to be 18 to use a Hoyer lift. Absolutely, that's accurate. And so that would be the kind of socialization like Matt's talking about, that they can serve as an STNA, but they can't do that. So, you know, it's this partnership and identifying those type of challenges and truly working together to ensure that it's a solution that's getting the students into the workforce sooner and learning all of the skills that they can. And even, you know, with the Hoyer lift, being able to see it, operate it, learn about it before they're eligible to touch it. I know we're going to run out of time. Are there other questions that we've missed in the chat? Again, Jacqueline, I see your hand up. Would you like to ask something?
Hi, yes. I just want to speak for the Northeast area. We're up here in Lakewood, Ohio, and my good friend over there in Cleveland Heights, Nancy Ballou. We are running STNA programs with success. My barriers tend to be on the employment side. So my kids can get a job, but then the employer seemingly doesn't have the flexibility to work with those limited hours that a high school student can do, or, you know, they're not always the most reliable employees as far as calling off for prom and calling off for all their events. So the work ethic part of it, I think, is a barrier a little bit, even though we're teaching those skills, but then employers, the flexibility, and I get it, you know, with payroll and staffing, that they have to have reliable staff members. So I think that's also something. I like the idea you said about having employers come and see what's happening in the career tech program, and maybe having a separate, maybe sort of category for those jobs, maybe, I don't know. But I think we're doing what the career technical curriculums are asking, and the Ohio Department of Education. So I think we're doing a good job at that. It's the barriers getting onto the employment. Thank you.
Thank you for that. I also see in the chat, Miami Valley Career Technology Center, MVCTC, is offering an LPN to RN diploma program. So we'd love to hear more about that, but I know we're gonna run out of time. Robin, do you want to help summarize for the group what we'll be doing next?
Yeah, so just sort of one more time. So first of all, thank you everybody for being here and offering some of this initial feedback. And I think, you know, going forward, you know, knowing, you know, where is the sweet spot and where are the barriers that we're finding in our different corners of the state, and getting that, you know, to our state representatives and others. I think that's where this sort of loose coalition and information gathering can be really helpful for all of us. So like I said before, we'll be sending an email out that just there'll be a recording of this session, as well as a survey that gets to these things, gets to, you know, what are you doing in your corner of the state? Can you share those kinds of things? And are you interested in being part of sort of a loose coalition? We don't know what that might look like, and we're looking to you to tell us what that, if that might be helpful and what that might look like. So those are sort of the next steps. And I guess the last thing I would say, I saw a couple questions in the chat that we didn't have time to respond to, that, you know, talk about like, well, how can, if you are, say, at a career center and you don't have, say, a PN program, or you're not offering STNA, and there's these rule changes, but it's like, it can be a little overwhelming. We want to be a resource to each other as well, in terms of how do we take it from 5 PN programs across the state at the career center level to something that's much greater than that, so that together the community colleges, the career centers can really start meeting the need. It's such a critical need. You know, we talk about the higher levels of masters and BSN and RN, but this is a critical, you know, need that we would need to work together to meet. So yeah, so I think that's all we've got, unless there's something else for the good of the order. All right.
I think we're good. Thank you so much. And thanks to everybody for being here. We'll work to get that communication out to you within the next week.
Bye, everybody.
Bye.